I wanted to take the time out to talk about a very real experience involving me that had to do with me ignoring my own body and pain that I was dealing with, and how it led to the discovery of a rare condition called ovarian teratoma that caused a torsion or twisting of my ovaries. This will not be a regularly scheduled YouTube video. This will be a little bit different. I wanted to take the time out to talk about a very real experience involving me that had to do with me ignoring my own body and pain that I was dealing with, and how it led to the discovery of a rare condition called ovarian teratoma that caused a torsion or twisting of my ovaries, and basically ended up with me having to undergo emergent surgery to untwist and try to save my ovary, and then remove this 9 centimeter, that's huge, about the size of a grapefruit, teratoma from my ovary. So let's get into this personal experience of mine. I have clips from the operating room. I have a picture of the teratoma. Well, just watch the video and you'll find out, okay? So I just got back from Mexico celebrating my husband's 50th birthday. This is us making this cute little TikTok reel while we were in Mexico celebrating his birthday. And within 48 hours of getting back from Mexico, I started to develop the worst pelvic cramping pain I've ever had. It was so bad that I caved and went to the ER. I thought I just had really bad constipation. Turns out it was a left ovarian teratoma, which is a mass that is made of mature elements like bone, fat, hair, and this was huge. It actually measured in the largest dimension 9 centimeters, and it had a ton of bones. You see all that white that just showed? That is bone in this ovarian teratoma. And because of this teratoma, they couldn't rule out the fact that my ovary that was attached to this teratoma was also twisted or torsed. And a torsed ovary is an ovary that is at risk of dying, because when it twists, the blood supply is cut off. So I had to undergo emergency operative surgery to untwist my ovary and remove this huge teratoma. That's my husband asking questions to the on-call surgeon, who happened to be my friend, y'all. It was serendipity. She did this laparoscopically and found the twist, and then went to work.
What is that?
That is an ovarian teratoma, which is a rare type of tumor that is formed from different germ cells or stem cells that migrate to an area and decide to grow. And the most common place for teratomas found in the ovaries. So women are more likely to get teratomas. And these different types of tissues can include bone, teeth, hair, skin, muscle, fat. It's very bizarre and looks really ugly and is kind of gross and kind of alien. But essentially, this tumor grew inside of me unbeknownst to me, any of my physicians, and got to be as large as 9 centimeters. Now, teratomas in the ovaries by far are most likely benign. This is most likely non-cancerous. thankfully. There are a small percentage, about 2% or less, that can be cancerous or malignant. The other thing to note is that my ovary probably would not have twisted without this teratoma attached to it. Ovaries that twist, or ovarian torsion, 90% of cases of ovarian torsion are associated with an attached mass that is attached to the ovary that's causing that extra weight on the ovary and leading to it twisting on its axis. And like I mentioned in the video before, when there is a torsion of the ovaries, it is twisting the blood supply. And so time is ovary. The more time that is delayed in getting it untwisted, the damage to the organ, i.e. the ovary. As a urologist, we see this all the time in testicles. There's something called testicular torsion. And I have done many of these surgeries. And I always say this, time is testes. I want to get the person into the operating room and get their scrotum open so I can untwist their testicle as fast as possible so we can try to salvage and keep the testicle. So this was a true surgical emergency. Fortunately, my ovary was able to be spared. They were able to pull this really bony teratoma out of a small, like 2-inch incision, thank God, and maintain a pure laparoscopic procedure as opposed to opening me wide up. And while she was in there, because I'm done with having children and because removing the tubes does decrease the risk of ovarian cancer in the future, she went ahead and removed my tubes, which I actually asked her to do before we went back into surgery. Now, I posted this entire saga on my Instagram, and you can find that at Dr. Milhouse, and you hit the teratoma highlight. But one really important question that was asked multiple times was, how did I not know that this huge thing was in me? And here's the truth. I did not know. I go to the gynecologist regularly. I go to my primary doctor every year. I get routine pelvic exams every year. And then in the United States, we don't ordinarily do routine imaging like a pelvic ultrasound unless there is something wrong, unless we suspect something either on exam or there's a symptom or complaint that prompts a pelvic ultrasound. Well, my pelvic exam was normal. I have pretty toned abs, and therefore it was difficult for any one of my physicians to actually feel anything. And I saw several different physicians just because I've lived in different areas over the years. The other thing is I never came in complaining about anything. And this is the most important part of the video. So when I think back, I had symptoms of this teratoma that I ignored. And so often I'm on here telling you all, don't ignore, make sure you get treated, speak up, advocate for yourself. And look at me, a healthcare physician, a urologist, a sexual medicine physician here ignoring my own complaints. So one of the biggest symptoms that I am convinced is attributed to this that I ignored was pain with deep penetration. So for the last 1 to 2 years, I have suffered from really severe abdominal cramping, off and on, not all the time, but occasionally, probably a third of the time, with deep penetration during intercourse. This pain would get so bad that I'd get nauseous. And at one point, I threw up after sex. Yes. And guess what, y'all? Did I bring this up ever to my gynecologist or my primary doctor? Nope. Did I rationalize it, minimize it, gaslight myself? Yes. Did I normalize it? Oh, it's nothing. This is just part of being a woman. Yes. And what am I doing? Telling you all not to do these things. So these type of behaviors are so entrenched in us that I wanted to use myself as an important example of listening to your bodies, not ignoring something, bringing it up to us. We may not have all the answers, but don't rationalize it within yourself and not bring it up to us. Had I mentioned this to just one of my physicians, it probably would have led to, well, let's just get a pelvic ultrasound and make sure there's nothing going on. And then bingo, we would have seen this ovarian teratoma. And I probably would have been recommended to have it surgically removed before I landed in the ER with it twisted. All in all, I'm happy that it eventually twisted and torsed, because who knows how much longer I would have gone without knowing that this was in my body. And we know that the longer that a teratoma stays inside, there is an increased risk of cancer. In fact, age over 45 is associated with an increased risk of being a malignant teratoma and not a benign teratoma. And I am 41. So here's my story. I really hope that you took away important encouragement and lesson. And don't be like me. Be better than me, all right? Let me know what you think. I want to hear your comments below. Hit me up. Make sure that you like this video. Make sure you share it widely. Share it with your friends, share with your mama, share with your sister, share with your girlfriend, their friends, all of that. And most importantly, make sure you subscribe so that you get all things down there right here. And I'm gonna go back to my recovery. Bye.